In just 6 months, we have all got used to a different way of life. Any hope that would change soon was dashed when the virus started spreading again. Now, with new curbs on our social lives and pubs and restaurants closing earlier, has the government today done enough to make any difference at all?
Pubs and workplaces are both social settings. They're environments where interpersonal interactions occur, and that's what the virus needs in order to be able to spread and in order to be able to survive. So if you remove those from people's day-to-day lives, there's less opportunity for viral spread.
For some who've had to shield, an encouragement to work from home again is a relief. Daniel HANVEY has cystic fibrosis. Despite advice to the contrary, he hasn't been back to the office. He's surprised the Prime Minister didn't go further.
I kind of fully expected that should there be a second spike, that there would be an official announcement that things were being put in place and, weren't being forgotten. I think the fact that nothing has been said about people who have been shielding is slightly unfortunate.
The government's own data tells us most transmission of the virus happens in the home. Residents in Scotland, Northern Ireland and even in some parts of England are now banned from mixing with other households. It's a measure many scientists feel is essential.
It's not clear why England has chosen a different path with households. They've done that in relation to the rule of 6, we're allowing it to be from 6 households. That's not the case elsewhere. And it may be they're not seeing the same patterns in their data in terms of testing and tracing. It's very clear up here that household transmission is a big risk. From what we know internationally, we really need to look at those type of interactions. And these restrictions are uncomfortable, but they're probably needed at the current time.
With 5,000 cases recorded today, few could argue we are now at a turning point.
Back in March, we were all asked to keep to restrictions to save lives and protect the NHS. In essence, that hasn't changed. But the reality is surgeries like this and hospitals are now seeing many more cases of coronavirus. And with winter coming, it won't take very much for them to be overwhelmed.
Honestly, I'm really anxious. It's younger people who, thank God, are not desperately ill and are not needing admission, but those people still need care and they're all coming to primary care. Normally, I would be seeing this level of activity right in the middle of a flu epidemic in November, December time.
Winter is coming and the new measures will not only have to curb the virus but also ensure the NHS can cope. If not, harsher restrictions are just weeks away. Emily Morgan, News at 10.